Hi, I'm Dr. Pentti Raste and I'm a specialist in myofascial pain. And this time we will look at the self-treatment of your arm and shoulder. It's quite easy that you can reach almost every point of this region by yourself. And one can do a lot treating the painful spots oneself. There are quite many reasons why the arm gets painful, and I will here treat a few of the most common examples. The muscles get gradually overstrained, they accumulate lactic acid, and then the muscles go into a permanent cramp and start hurting. One of the reasons is very commonly now with the computers, the so-called mouse arm. Working with the arm, with the mouse in a tense, not an ergonomic position, overstrains the muscles and your arm and shoulder start aching. Another type of cause might be reading a book in your bed, supporting the book or the newspaper in your arms, and that static tension gradually will cause pain. Other things very common are golfer's arm, tennis arm, which the pain comes from the repeated jerks for muscles and tendons when you hit the ball or you hit the ground. Then another common thing is the sudden overstrain of the arm, doing something we don't do every day, and that's perhaps, for example, painting the house or cleaning the windows. Those repeated movements, which we are not used to do, might overstrain the arm and start the pain. I get also patients who come here with shoulder pain after the traveling to, for example, to Spain here, and they have had very heavy suitcase, and carrying the very heavy suitcase can also trigger on the shoulder pain. I'll mark the points here, and I show the most common pain points where to search for them, and then I'll show you how to apply the massage on the points, and gradually the arm will become better. You have to do the massage at least one point. It must last about 10-15 minutes. The massage must hurt a little bit, not too much, and it might leave the arm sore, tender after the treatment for a few days, and then when the tenderness has gone, then you can have another session. So in a minute I'll show you the points and how to treat them. Now let's have a look at the points which I have marked here with red. There are quite many points where you can have pain. There is one here in between the first and the second fingers, deep in here. Then you can have points just above the wrist here, which can be hurting, following the muscles. The very common point for tennis arm is on this side here, this area, this point and this point, and you can feel the soreness when you rub the points a little bit detail with your finger like this. So this is how you find them. Here on the other side, this is usually where golfers get, at least in the right arm, they get on inside the pain, here in the place where the muscle tendon is joining the bone. On this side too might be painful. The biceps here, there are painful spots often here. It's a bit slippery, so you have to try to push the finger against the bone. Higher on this side, well, the deltoid muscle fixes to the bone. Here, a little bit above the joint here. At this point, more to the inside of the shoulder. On the shoulder itself here, you might find painful spots a little bit higher still on the back side of the shoulder, and like this. And then the massage, you can use your fingers, or you can use a sort of round thing like this stick, which if the fingers are not used to treatment and massage, they might get tired, so you can use a thing like this. And then you just massage the points like this with your fingers. Round, pressing always against the bone, the hard bone which is lying underneath. And going through the muscles, changing a little bit the position, you can get better grip for these muscles, having the hand like this. You can use your thumb, you can use your knuckles, and you can use a little bit of, even if the points are quite concentrated, you can use technique which is a bit more general for the whole muscles. Go through the muscles like this, massaging. Here you can do like this here. You find the points. Here you can use the knuckles again. You can use the knuckles, one here for example, all the knuckles here, and then you can come with your fingers like this around the shoulder joint and find the points here. There are usually points here, a little bit further in to your breast. This is very often so when the shoulder is sore. This is not, I haven't marked the point here, but you have to feel around a bit. And then the other side here, the back side, it's very often here we have a few painful spots which you can reach like this. And then you massage, as I told you, more or less 10-15 minutes at a time in one session, and you leave muscles alone for a few days to recover from the first treatment, and then you can do another session. And there is nothing you can really harm. You can't do anything wrong. The pain tells you where the limit is, and this is a safe and good treatment.